Genito-pelvic pain/penetration disorder represents a complex and multifaceted condition that profoundly impacts the intimate lives of countless individuals worldwide. This disorder, which encompasses what was previously classified as separate conditions including vaginismus and dyspareunia, creates significant barriers to sexual intimacy and can deeply affect psychological well-being, relationships, and overall quality of life. The manifestation of genitopelvic pain/penetration disorder varies considerably among affected individuals, but typically involves persistent difficulties with vaginal penetration during intercourse, gynecological examinations, or tampon insertion. The condition is characterized by one or more of four primary symptoms: difficulty with vaginal penetration, genitopelvic pain during penetration attempts, fear or anxiety about genitopelvic pain or vaginal penetration, and marked tensing or tightening of the pelvic floor muscles during attempted vaginal penetration. Understanding the etiology of genitopelvic pain/penetration disorder requires examining both physical and psychological contributing factors. Physical causes may include infections, hormonal changes, surgical complications, childbirth trauma, or underlying medical conditions affecting the genital area. Psychological factors often play an equally important role, with anxiety, past traumatic experiences, negative beliefs about sexuality, relationship difficulties, or general stress contributing to the development and maintenance of the condition. The interplay between these physical and psychological elements creates a complex cycle where pain leads to anxiety and muscle tension, which in turn exacerbates pain and perpetuates the problem. The diagnostic process for genitopelvic pain/penetration disorder involves comprehensive evaluation by healthcare professionals who specialize in sexual medicine or gynecology. A thorough medical history is essential, exploring the onset, duration, and specific characteristics of symptoms, as well as any potential triggers or contributing factors. Physical examination, when tolerated by the patient, may help identify anatomical or physiological abnormalities that could contribute to the condition. However, healthcare providers must approach examination with extreme sensitivity, as the anticipation of pain or discomfort can significantly heighten anxiety and muscle tension. Treatment approaches for genitopelvic pain/penetration disorder are typically multimodal, addressing both the physical and psychological aspects of the condition. Pelvic floor physical therapy has emerged as a cornerstone treatment, helping patients learn to relax and control their pelvic floor muscles through specialized exercises, biofeedback techniques, and manual therapy. These interventions can significantly reduce muscle tension and improve voluntary control over pelvic floor function. Psychological interventions play a crucial role in comprehensive treatment plans. Cognitive behavioral therapy helps patients identify and modify negative thought patterns and behaviors related to sexual activity and penetration. Mindfulness-based approaches teach patients to stay present during intimate moments rather than anticipating pain or discomfort. Gradual exposure therapy, often combined with relaxation techniques, helps patients slowly become comfortable with increasing levels of vaginal penetration using graduated dilators or other tools. Medical treatments may include topical anesthetics to reduce sensitivity during initial treatment phases, hormone therapy to address hormonal imbalances that might contribute to pain, or medications to manage anxiety or depression that may accompany the condition. Some patients benefit from trigger point injections or other interventions targeting specific areas of muscle tension or pain. The impact of genitopelvic pain/penetration disorder extends far beyond the physical symptoms, affecting emotional well-being, self-esteem, and intimate relationships. Many individuals experience feelings of inadequacy, frustration, or shame related to their condition. Partners may also struggle with feelings of rejection, confusion, or helplessness when faced with their loved one's difficulties. Open communication between partners becomes essential for maintaining intimacy and emotional connection while working through treatment. Support systems play a vital role in recovery from genitopelvic pain/penetration disorder. Healthcare providers who demonstrate understanding, empathy, and expertise in sexual medicine can significantly impact treatment outcomes. Support groups, either in person or online, provide opportunities for individuals to connect with others facing similar challenges, reducing feelings of isolation and providing practical advice and encouragement. The prognosis for genitopelvic pain/penetration disorder is generally positive with appropriate treatment. Many individuals experience significant improvement in symptoms and quality of life through comprehensive, multidisciplinary approaches. However, recovery often requires patience, persistence, and commitment to treatment plans that may extend over several months or longer. Success is typically measured not only by the ability to achieve comfortable penetration, but also by improvements in overall sexual satisfaction, relationship quality, and psychological well-being. Prevention strategies for genitopelvic pain/penetration disorder focus on promoting healthy attitudes towards sexuality, ensuring adequate sexual education, and addressing risk factors early. Healthcare providers play a crucial role in creating supportive environments for discussing sexual health concerns and providing appropriate referrals when needed. Early intervention for conditions that might contribute to the development of genitopelvic pain/penetration disorder can help prevent progression to more severe forms of the condition. Research continues to advance understanding of genitopelvic pain/penetration disorder, with ongoing studies examining neurobiological mechanisms, improved treatment approaches, and factors that influence treatment outcomes. This research holds promise for developing more effective interventions and better understanding the complex interactions between physical and psychological factors in sexual pain disorders. The integration of genitopelvic pain/penetration disorder into modern diagnostic frameworks represents an important step forward in recognizing the complexity of sexual pain conditions and moving beyond simplistic categorizations. This comprehensive approach acknowledges that successful treatment requires addressing multiple dimensions of the condition rather than focusing solely on physical or psychological factors in isolation. Healthcare providers working with individuals affected by genitopelvic pain/penetration disorder must maintain sensitivity to the intimate nature of these difficulties while providing evidence-based treatment options. Creating safe, non-judgmental environments where patients feel comfortable discussing their concerns is essential for effective treatment relationships. The journey toward recovery from genitopelvic pain/penetration disorder is often challenging but ultimately rewarding for many individuals. With appropriate support, comprehensive treatment approaches, and patience, many people successfully overcome this condition and develop fulfilling intimate relationships. The key lies in recognizing that genitopelvic pain/penetration disorder is a legitimate medical condition deserving of professional attention and treatment, rather than something to be endured in silence or shame. Understanding genitopelvic pain/penetration disorder as a complex condition requiring multifaceted treatment approaches helps reduce stigma and encourages individuals to seek appropriate help. Through continued research, improved treatment methods, and increased awareness among healthcare providers and the general public, outcomes for individuals affected by this condition continue to improve, offering hope for those currently struggling with these challenging symptoms.